Hello, everyone, and welcome to our monthly community podcast. My name is Anais Mares, Health Promotion Specialist here with Siouxland District Health Department, and today we are going to be talking about our health maintenance and Homemaker personal care programs here at the Health Department. And joining us to talk about these programs is Amber Hunwardsen and Kellie Zvirgzdinas. Welcome, and thank you for joining us today.
Good morning.
Now, Amber, you've been on our podcast before, back in March, to talk about TB. Would you just like to remind the public about what you do here and how long you've been with the health department?
Sure. So I have been here at the health department as a public health nurse for 22 years. I work in a variety of different programs. And like she had already said, tuberculosis. I work in the shot clinic for kids. I work in the lead program, home visitation, work on travel shots, doing STIs, and then the health maintenance program, and that's what we're here to talk about today.
Mm-hmm. Thank you, Amber. Kellie, this is your first time on our podcast. Would you like to talk about what you do and how long you've been at the health department?
Again, my name is Kellie Zvirgzdinas, and I'm the program manager for the Homemaker personal care program, and basically looking at what the community has to offer to help the individuals remain independent in their own home. I've been here for 16 years.
Okay. Thank you, Kellie. Now, Amber, can you tell us a little bit more about the health maintenance and personal care program itself?
Okay, so the health maintenance program itself is a nurse goes into a client's home, and we work under a doctor's orders, and we can go in and we assess the home for safety. We assess a client's mental, physical status. We can do medication management, which includes assessing them for side effects, education on their meds. We can administer injections such as Ozempic, Haldol injections, other injections for mental health, vitamin B12 injections. We can do blood draws as well. We can refer to other agencies in the, if we see there's another need in the home, we can refer to other places here in the community. We coordinate with clients, doctors, pharmacies, other organizations in the community, as well as their caregivers or family members that are working with them in the home.
And all of these services are done completely in their home?
Yes.
Okay.
Yes, they are.
So
That's
you go
correct.
out to them?
Yep, we go to their place where they reside.
Okay, thank you. And Kellie, can you tell us about the Homemaker program?
Sure. The Homemaker personal care program, again, is much like home health, where we go into the home. We have individuals who can help with personal care, such as bathing, and then we also can help an individual with some homemaking tasks. So those would include vacuuming, dusting, cleaning bathrooms, and doing some laundry. We know as individuals are aging and or have a disability that they're at a great fall risk, and they just can't do a lot of bending and stooping. So that's where we can come in, help them remain independent in their home, but do those things for them.
And who would qualify for both of these programs?
So for the health maintenance program, and the personal care homemaker program, they have to live in Woodbury County.
Okay.
They have to be a Woodbury County resident. So for the health maintenance program, they need to have a chronic, stable condition. They can't be going in and out of the hospital, having a lot of med changes, seeing the doctor frequently, something acute going on. They have to be chronically stable in order for a nurse to go out, because we do not go out and see them, 2-3 times a week. It's usually every 2 weeks to 4 weeks sometimes when we see these clients in the home. And they have to meet financial guidelines and follow a sliding fee scale. They cannot have like full Medicaid. They can have Slim B or Quimby, which is partial Medicaid, to qualify for these services. And they can't have a skilled need, and be considered homebound. They cannot be receiving IV therapy, wound care. Say they got just newly diagnosed with diabetes and they need a lot of teaching. That's something that we do not do. Okay. But what we can do is when they are on the end of that, we say they're skilled need, they're under Medicare, after they've met their goals and they're not homebound anymore, then we can come in and see these people. They need that extra set of eyes. We're just there, like Kellie kind of said, that second set of eyes is always good for somebody. so they're not so fearful. They just know that they can rely on us. They have somebody they can call,
right,
and we can answer their questions, or we can go out there, if they are having a problem. It doesn't have to be every 2 weeks, but if there is an issue, we can go out there and see them. So kind of eases their fears living in the home if they are by themselves.
Are the qualifications for one program the same for the other program, or are they different?
They are different.
Okay.
So the Homemaker Personal Care Program does not require a physician order to provide those services. Again, they do require to be a Woodbury County resident, and we do have that same financial sliding fee scale that they have to fit that criteria for. There are a lot of individuals who could have either both of those programs in their home or just one or the other. Kind of really depends upon how they fit within that financial piece. So our visits can range anywhere between 1 to 3 hours, depending upon the need of the client. Typically, a bath would not take more than a half an hour to 1 hour. But when you're doing some homemaking skills and maybe doing laundry, those can range anywhere between 1 and 3 hours.
Okay. So you kind of touched base that, someone may qualify for the health maintenance program, but not necessarily the personal care program, and vice versa, and there are clients that are in both.
Correct.
How does one go to apply for these programs? Either one, the other, or both?
They would need to reach out to either one of us. They could go to our website and, of course, read again which each of those programs details, which would be at SiouxLandDistrictHealth.org. Or they can call 712-279-6119 and ask to speak to Amber or myself, Kellie, or my direct line, which is 712-234-3927. And really, we encourage them to call. There's no real application to fill out because we need to walk through that financial piece and kind of see where their eligibility lies. Okay. If it's something that we can't assist them with, then, of course, we will reach out to other community members, such as Area Agency on Aging. And we also work with a lot of the discharge planners at the hospitals, different social workers, case managers, so we can kind of filter through all of those.
Okay, yeah, sounds like if we can't help them, we can
reach
get
out
them
and get
to someone who will.
Help them. Yep.
Gotcha. So you mentioned your contact info. If someone has additional questions, is that who they contact? Do they contact you, Kellie, or you, Amber?
Yep. Yes.
Yep.
Okay. Yep. Okay.
And we can answer for both programs.
Okay. Yep. Awesome. So is there anything else you would like to add about these two programs that you think the public should know or is important?
I would really encourage individuals, as Amber had indicated, that they're no longer maybe homebound and they've already received services through a Medicare or Medicaid certified agency. We still know that, again, they're vulnerable. They still are probably at a high fall risk. So that doesn't mean that we can't step in there and then continue to help them. So they're probably still eligible. They just wouldn't be under a Medicare cover. They would be under our program and still get those same types of services.
Okay. Anything you would like to add, Amber?
No, I mean, just call because the eligibility and, figuring out who can be apply for my program and for Kellie's, is different. So
right.
We can just answer and guide them through those questions and figure out if they do qualify.
So one last question for you both. Are these services available in other languages other than English?
Yeah, I have a client right now that we serve in the home, and he's Hispanic, so I take an interpreter, or we can use Language Line, but we have interpreters here, and I put her on speakerphone and talk through that way with him since COVID. Otherwise, she did go in person, so it can be either in person.
Language isn't an issue.
Not a barrier.
Okay. No. Perfect. Awesome. Well, thank you once again, Amber and Kellie, for joining us and talking about our health maintenance and Homemaker personal care programs here at the health department. They are great services that I don't think enough people know about. If you have any additional questions, please feel free to contact us, 712-279-6119, and ask for Amber or Kellie. Thanks again.
Thank you.
Thank you.